Sorry, one more time. Okay. Hold on. Okay, here we go. All right, here we go. Hi, everybody. It's Mark Adahar from XSculpt. I'm one of the surgeons and testosterone replacement specialists here. I'm here with Allan Adahar, who many of you, Dr. Allan Adahar, who you've been following on our Instagram, Facebook, and YouTube channel. He is on his journey transformation to lose about 100 pounds over a year, and he's off to a great start. Part of the process is we sent laboratory examinations, and we got some of them back. We discovered that Allan's testosterone level is only 250. The normal range is from 197 to 900. However, 197 is normal for probably an 80-year-old man, and 900 is normal for an 18-year-old kid. So Allan has the testosterone level of about 70-year-old man, and we need to fix that. His levels being 250 is probably the reason why Allan hasn't been able to lose any weight despite his efforts in the past times. So once we get Allan's testosterone up to awesome level, his efforts in weight loss and exercise and muscle building will be, greatly enhanced. It's, I kind of tell patients it's like going cross country. You could either do it at a bicycle and you'll get there eventually, but it's going to take a lot of effort and a lot of time, or you can do it in a car where it'll be a lot faster and a lot more efficient. Okay? Questions? Ready for this?
I do have a question.
Yeah.
So, if you do testosterone pellets, so if my testosterone level is low, what's the difference between pellets and using one of the topical testosterone replacements or testosterone oral medications?
Okay, first of all, okay, that's a good question, and I have videos on our YouTube channel that goes into this specifically, but in general, there are different ways to replace testosterone, and at XSculpt we like to use testosterone pellets because it's bioidentical, which means it's natural and your body can absorb it a lot better. It doesn't require injections like the most popular, which is usually an injection once every week. For you, it'll probably be twice every week. It's a lot more effective because we want you to get to a level of about 1,000. Once we insert these pellets, you'll be at 1,000 for 6 months straight, without 24/7 for 6 months. So you don't have to do any injections, you don't have to worry about it. If you inject yourself on, for example, you'll inject yourself on a Monday, right?
What do I inject with?
Testosterone. You can inject, this testosterone is injectable. There is injectable testosterone.
If I were to choose that.
If you were to choose that, or if we decide to do that, you would have to inject yourself on Monday, and then you'll feel great Monday, Tuesday, Wednesday, and then around Thursday, Friday, you start dipping down, and then you are at baseline by Saturday, and then you inject again on Monday. And so that spiking, a lot of people don't like, number one. Number two, injecting yourself kind of sucks. Number three, you get a lot of the side effects from those spiking. Because when you inject yourself with testosterone, you shoot yourself up to about 2,500. And then you slowly go down. So the average is about 1,000. But when you were younger, your body never spiked testosterone. It was always kind of a plateau, right? And so the pellet therapy is a lot more physiologic. The creams, there are creams, but it's very, it sucks because you have to apply it onto your inner arms usually. And then what happens is you have to wash your hands, you have to wash the sink where you used it, you have to be very careful what you touch because you can transfer it to your loved ones. Also, during the day, it often wipes off on your clothes if you sweat, and usually to dose a testosterone cream is extremely difficult. You're 250, it might bring you up to 400, 450,
So it's not as effective.
It's not as effective. It's good for women because women don't have to have that high of a level, but we also do pellet therapy for women as well, by the way. You can't do injections for women. Well, you can, but it's kind of dangerous.
So being an OBGYN, is testosterone pellets safe in women, and is it safe in pregnancy?
Okay, so in women, yes, completely safe, and actually nationwide, the ratio from women to men who's getting pelleted is like 4 to 1. Actually,
so why would you want to put pellets in a woman, testosterone pellets in a woman in the first place?
Because women also require testosterone. It's just that they only require 10% of what men have. And they get the same benefits, and actually some other benefits that men don't get. Now, in pregnancy, we do not pellet anybody. In general, we do not pellet anybody who's pregnant. Technically speaking, you don't pellet them. They cannot have the pellet within them at the 3rd trimester.
So if you were to pellet a female and then she gets pregnant, it's still okay, just as long as it doesn't last into the 3rd trimester.
Correct. Excuse me, because in women, the pellets only last 3 months. So, so let's say, for example, a woman gets pelleted on Monday, and on Tuesday she finds out she's pregnant. We just let the pellet burn out, and then she's good to go with no side effects to the baby or whatsoever.
Last question. Speaking of side effects, what are the side effects that I can anticipate after this procedure?
After you get any procedure? Okay, so that's why, oops, hold on. Okay, stupid selfie stick. Okay, so that's why it's super important. I'll hold it with this hand, how about that? Okay, that's why it's super important that we follow your labs regularly, okay? All the side effects, the majority of side effects that come from testosterone therapy, it happens because your levels are too high, okay? And sometimes because it's chemical versus bioidentical, but it's because it's too high. And we don't want you to be super therapeutic. We don't want you in 2000s, bodybuilders sometimes get 5,000, 6,000 levels. So if we monitor you closely, which we plan on doing, the side effects should be minimal. However, that being said, to answer your question, some side effects is the potential hair loss, okay? There is potential hair loss.
Thank God I don't have that problem.
Nice. Maybe on the left side.
So what can I do to avoid that?
Well, if that starts happening, we do several things. Number one, we drop your dose by 10%. Number two, we start you on finasteride.
Can I just start that now?
Yeah, we can do that as a preventative measure. There's no problem doing that. And then, yeah, so those are some of the methods we can do.
And is it effective?
Yeah, especially when we drop it, when we drop a little bit. That's number one. What can happen, we also check your red blood cells, because one of the benefits of testosterone, it makes your endurance much better. Increases oxygen delivery to your tissues. However, some people's red blood cells go too high. So so we have to check your blood regularly. And if it goes too high, we have two choices. Number one, drop your dose, or number two, you donate blood every 3 months. Most people decide to donate their blood every 3 months because no one likes to drop their dose. So, but that would be the second side effect we watch for. Now, some early side effects that
Leeches
no, we don't do
is the
leeches
third
anymore.
option.
No,
Leeching.
we don't do leeching anymore.
Leeching.
So one of the third things that you may experience in the beginning is water weight gain because of the rapid rise in hormones. So you may gain weight in the beginning, but don't freak out. What happens, you can either drink dandelion tea, take vitamin B5, and I mean, if it gets really bad, we can give you a diuretic. We don't normally do that because usually it resolves spontaneously. Also, a low sodium, low carb diet will help with that.
Okay, last question. So I have a workout appointment with Daniela after this.
Uh-huh.
Can I work out?
You can work out, but you can't do legs or cardio for 5 days. Yeah.
Okay.
Okay.
Thank
good.
you.
I think that covers the real basics of it, but like I said, I have other videos on our YouTube channel where it goes into a lot of these issues very specifically, and I'll be posting more videos on Instagram, Facebook, as well as our YouTube channel regarding Allan specifically how the treatment plan goes.
And don't forget to subscribe and smash that like.
Jesus. All right. Take it easy. Bye.
Bye.